It seems like people who find out that they have diabetes or even prediabetes may feel it's presenting some real challenges for them. What are some of those challenges, and how do you recommend they deal with those challenges?
It is true. In my experience now, when we make the diagnosis, if they come and we've made the diagnosis or their primary care has made the diagnosis of diabetes, we first deal with sort of the psychological aspects of how to accept this, because many of them, because of family history, have lived with a grandparent or a parent or a sibling who's had diabetes, and they've seen those challenges, and now they have to accept them. And so we want to work with them first on where they are in this continuum of accepting a change in this diagnosis. Sometimes for many they feel like there's a loss. There's a loss to their health or a loss to freedom. I have to check my blood sugars. That seems inconvenient. I have to go to the doctor more often. That may mean time out from work. And so we want to work with them to accept this and accept it in a positive, meaningful way so that they can then feel like they're in control. So I think first and foremost is acknowledging that yes, we understand that this will require a little bit of taking a breath, coming to terms with it. What does it mean relative to your life experiences with diabetes, and then accepting it. And that can sometimes take time. And we oftentimes may even need to use the help of a psychologist to make those referrals to help them to combat and face the challenges of accepting something that is a chronic challenge. I really try to avoid using the word a chronic disease, but it is a daily challenge to what they want to accomplish. And I think first of all what I like to do is know what are their goals, what is it that they want to accomplish. Mm-hmm. So for instance, say a young woman who has diabetes and she's looking to become pregnant and have a child. Well, working with her and her husband then, if this is the goal, this is what's going to be required, and trying to tailor the needs to her then. If it's someone a little bit older, what we try to do then with the diabetes is explain how in getting to the part of acceptance of what's required for you to be in control, it's going to help you with the complications of diabetes for improved cardiovascular function, but also brain health. To try to really reduce the risk for a stroke, a mini stroke, which most likely will keep you disabled, and we don't want that to happen. So you have to tailor the needs for the patient, where they are, their lifespan, and how you can help them to come to terms with setting goals on a daily basis. Because most people will set a goal. I want money to buy a home or a car, or I want the vacation. So helping them to incorporate how to set goals for their blood sugar monitoring from an aspect that's important for them for their health.
But I think I hear some encouraging news there too, which is there are things they can do, or if they do the recommended changes, then there's a good chance they can hold off the most serious complications and have a better life. Am I right on that?
Absolutely. So first is to understand that at the time that they have the initial diagnosis, it can feel overwhelming and they can feel sad, out of control, and it's important to work with your healthcare provider to acknowledge that there has been a change and how to get you to use the tools that are available to accept the challenge that you have before you, but that you can master it, and to set goals of what you want to accomplish for your health as you set goals for other aspects of your life. That's really key, I think, because if we fail to do that, and I've had my experiences doing that, if I fail to do that and I really just dive right into, all right, I need to see a diabetes educator, cut your calories like this, exercise like that, take the medication, see you in 3 months, I've learned that that's really not the best way to advise patients to accept something that requires a daily commitment to accomplish their goals. So first is to deal with aspects of their spiritual health, their psychological health. What does diabetes mean to them? What do they know about diabetes? What myths do I have to dispel? Some, for instance, they've seen older patients who might have relatives who might have been on insulin therapy, and they say, oh, if I start insulin, I'll get my leg amputated. No, that's not true. It's just that perhaps in your experience of seeing a loved one, maybe there was a delay and too long in initiating those types of treatments. Complications then went out of control and they wind up having a leg amputation. But they'll associate an insulin injection to a leg amputation, and we need to disconnect that association. So I think it's first for healthcare providers to acknowledge that there is a loss, a perceived loss. I can't have cakes anymore. I can't have birthday parties. There are so many things I can't do, and we try to discourage that aspect that there's a loss or there are things that you can't do. There are actually lots of things that you can do to be in control and hit your targets and hit your mark. And then dispel these myths that creep up because of their associations through their family. So I am optimistic. I've learned through time to address that first, then go into kind of more of the checklist of the things that you need to do.
It sounds like sort of at least a two-step process. One is acknowledging that you are going to have to make some changes and maybe give up certain things, but then realizing that you can gain control over this
Yes.
and really have a good effect on your health.
Yes.